Hi, my name is Braden Smolko, and today I'll be presenting COVID-19's impact on U.S. hospitals, a look back and a peek forward. This is part of an assignment for UMGC's Data 620 course, and the data can be found at healthdata.gov. This presentation aims to provide a look back on how hospitals have been impacted over the course of this pandemic, as well as a small forecast into the future, showing what we can expect. So when I'm talking about impact, I'm talking about patients in hospitals with COVID. So what we can see here are linear trend lines indicating a significant relationship between patients in hospitals that have COVID and how overwhelmed these hospitals are. So when we're looking at the timelines to come and the time lapse, we should keep in mind that as patients with COVID increase in hospitals, this is really indicative of how overwhelmed they are and the critical staffing shortages that are taking place. So looking at how hospitals have experienced this pandemic over time, we see three main bumps. We see the initial spike, the summer spike, and the end-of-year spike. The initial spike, starting with consistent reporting, this is when the pandemic really takes hold in the US, and we start to see massive numbers of cases in hospitals across the country. After the initial spike, we see precautions put in place, more is known about the disease. So we see a decrease in the patients in hospitals with COVID before a summer spike in mid to late July, followed by the lowest point we've seen since the beginning of the pandemic in mid-September, before this massive explosion of cases where we see this end-of-the-year spike, Thanksgiving, Christmas, New Year's, all in one. We see countrywide, we have a large number of cases in hospitals, and these hospitals are becoming overwhelmed towards the end of the year. So what you'll see I've noted here, vaccine rollout begins December 14th, and we also notice a decline to come to where we are now, and as we see a decline in cases starting at the beginning of January. So breaking this down by region, let's take a look. As we can see here, what's interesting is we see this initial spike occurring across all of the regions in the US, but particularly the Northeast is hit really hard. I'm sure many of you, like me, remember stories of convention centers in New York City being transformed into makeshift hospitals. There was a huge need, and hospitals were really overwhelmed in New York City, in the Northeast in the beginning of this pandemic. We'll see that, interestingly enough, there's still a summer spike and an end-of-the-year spike, but it seems like the Northeast has almost kind of learned, in a sense, after the initial spike, and hospitals were more prepared to handle these patients in the following parts of this pandemic. So some key points to note for the time lapse that we're about to watch. We have the Northeast being the leader in the initial spike, then we see hospitals impacted in the South and the West for the summer spike, and then for the end-of-year spike, we see the Midwest, followed by the rest of the country for this countrywide end-of-year spike. So let's take a look at this as a time lapse over the course of the pandemic. So we'll look at this rather fast. And so let's take a look here. We have early parts of the pandemic, New York, New Jersey, getting hit rather hard. Cases decline before we see Arizona, and then the West and the South really having hospitals impacted before cases decline at the end of summer again. And then we'll start to see more red appearing in the Midwest, followed by the rest of the country as this explosive end-of-the-year spike occurs. As we move from December into January, we're at about 1 month here after the vaccine rollout has occurred. So we're seeing California, Arizona, some red spots. But what's really interesting to see here is as we move from January on to where we are now and towards the end of the data set in February, we start to see these colors really start to dissipate. Really seeing the impact of this vaccine rollout. February 28th is 2.5 months after, and we still have some spots, but compared to December and November with the huge end of the year spike, where we are now is really incredible. So looking towards the future, we see a default Tableau forecast indicating that COVID patients could be gone completely by April, June, July. I don't think this is really correct. This is a bit optimistic and perhaps a bit naive. I would probably expect more of a curve to plateau out here, or maybe a resurgence towards the middle of the year. But I think what's really important to note is there's just factors that aren't in this model that aren't accounted for. Things like new strains that are coming out. We have children returning to school. We see vaccine hesitancy. So there's a lot of factors not included in this model, and I think that's why we see such a consistent and linear decline in cases predicted. But it sure would be nice to see the end of this pandemic in just the next few months. So if you're interested in this data, I highly recommend you check it out. You can find it at healthdata.gov. Thank you for watching, and I hope you got more of an overview of how hospitals have been impacted over the course of this pandemic and what we can expect in the future. So, thank you.